in the age range of 50 and above, there are significant issues with falls risk. And if we could design something that people can use on an everyday basis that would help with better alignment, we would see, in some cases, dramatic improvements in the ability to lift our arms over our head and reach into shelves, take a nice breath, and perform outside activities like gardening. Bowel and bladder issues would be better, but balance would be improved. Right now, according to the CDC, falls is the third leading cause of death in the United States, and poor balance is implicated in that. So a few of the postural measurements that we did in our study, which showed improvements, was, number one is something called wall to tragus. What it is, it's a measurement of the notch in the ear to the wall. So if we imagine that there's a wall behind Ginny here, and for the most part, I would move around and I would measure this. This measures what's called forward head posture, how far forward her head is in front of the shoulders. A second measure that we looked at in our study was rounded shoulder posturing. So particularly in the 50 and older population, we see a lot of rounded shoulder in their presentation. Keep in mind that we have moved to a sedentary society. So 75% or better of the American population works in front of an electronic device, an iPad, a computer, or a cell phone, seated. What we do in physical therapy is we prescribe corrective exercises, but if we could also augment that with a posture garment, which a TG posture garment is that we'll see an improvement in rounded shoulders and the head will move back. In our study, we saw improvements in both of these. If the patient is here and they lift their arms overhead, we see a dramatic improvement as well, as opposed to being down, slouching, and now trying to lift her arms up and she gets stuck. So if you look at Ginny from the side, what has happened is that we had discussed forward head, rounded shoulder posturing. Her shoulders are back. Usually when your shoulders go back, your head will follow. If we think about alignment now of her spine and all the issues I discussed previously, such as breathing, elevation of the shoulders, bowel and bladder, digestive issues, and balance, which Ginny's going to talk to in a second, how she felt that her balance really improved using the posture garment.